Great, thank you. So I'll just ask one question and then throw it open to our committee members. For clarification, there's no embargo?
No.
So as soon as the data is generated,
as soon as it's
online.
QC'd, it's made sure that there's no issues. It goes to Loney, particularly the imaging data, and it's uploaded immediately. So usually within a couple of days when it's generated. So there's no embargo.
So this is sort of a different model for the production of data because you don't have investigators
Correct.
themselves who put in a proposal to generate the data, who have an investment in getting yield out of that data.
Right, that's what I'm saying. So at the get-go, it was a shift in culture for the investigators have to know they had no special access on the data at all. It was going to go up immediately once it was
And why would investigators or agree to spend time on this aside from just getting their salaries paid?
Well, I mean, it's generated, as I said, over 636 manuscripts. Many of those are coming from the ADNI investigators themselves. Not all, but many. So I think despite the fact that it's been up there, I think someone pointed out the ADNI investigators do have the most familiarity with the data. So they don't have the learning curve. So they are able to get the data out there. But it's been, I have to say, I wasn't there on the initial discussions. I would have loved to have been. I started in 2005. ADNI started in 2004. But yeah, so there was a lot of wrangling, from what I hear initially, in getting people to agree to this model.
Do you have any information or data on whether your manuscripts come out more quickly than other models for?
There is some of that. I don't have it in my slide deck, but yes, they do actually come out quicker.
Interesting. I could ask other questions, but I asked too many before, so let me ask if the committee has questions for either of these. Tim? Oh, I'm sorry, Artie.
Hi, this is a question for Jessica. I take it from your website that there is the possibility, and I think you noted it as well, of people getting data from multiple sponsors and then pooling it essentially.
Yes.
Have you had that happen yet? And how would you need to negotiate access agreements de novo in that context? So you have a sample agreement, but that looks like it only works with one sponsor. The one on your website only works with one sponsor. So I'm just wondering well, A, whether you've had people wanting to pool data, and B, how the data access agreement will work in that situation.
So the access system is up just since January 1st, and I'm not aware of the requests that have come in for access to multiple sponsors since that time. The same data sharing agreement is used by all the sponsors. And so that simplifies that aspect. And there is a committee of data sharing coordinators from each of the sponsors that works together to coordinate the responses when there are multiple data sets requested by different sponsors.
Oh, I'm sorry, Jeff, yes, you were next, and then Bernie.
So, Laura, you said that there were lots of ADNI people who were using the data. Is ADNI getting credit when they put in their grant renewal, study sections take advantage of this?
Yes.
And what's the mechanism for giving ADNI credit when they publish?
Well, ADNI is actually listed on all publications, the ADNI data, and that's part of what the review committee looks at. There is actually language that is supposed to go on each one. So they do have that, and actually if you go to the ADNI website, you can look at all of the publications that are listed. And when they did, I know when they renewed the grant, which was for the now ADNI 2, that they actually were able to list all of those as in the appendix, essentially, for the reviewers to look at, to see the usefulness of the ADNI data. So I think it did benefit them.
And out of the $100 million or so that ADNI has cost, what fraction has been can be attributed to warehousing and allowing the data to be shared?
I think you already 2%? Brought that up. I think that's roughly right, about 15% of the overall budget.
Serious money.
Yeah. No, I was just going to. By the way, I consider ADNI admirable in terms of what it's done, but also it's not necessarily applicable to a randomized controlled trial, which is obviously the focus of this committee. There's an interesting thought experiment, what would be involved. The other thing is we interviewed the principals of ADNI, and that's how we got this estimate of 15%, including Neil Buchholz. But, I mean, can you imagine going to NIH and putting in a grant application and in your budget, 15% of your budget on data sharing? I mean, or any kind of sponsor for that matter. So I just want to point out that I think the costs are real, but the reality of actually dealing with the costs, as NIA has done prospectively from the beginning, is different. So doing something prospectively and then trying to retrospectively catch up with it is a big difference, and also a big difference in cost.
Bernie?
Yeah, first I was asked to make an administrative comment. It turns out more than two people have their mics on at the same time. There's this horrible interference pattern in the people listening to it. So to save her hearing, we're asked to turn off our mics when we don't talk, but turn it on when you talk again. I have a question, particularly for Jessica and but also for and Joe, I guess, which has to do with clinical trials that have already been completed. So I know that a lot of the focus is on trials going forward, but as I remember, there's some ability for people who want to look at an older clinical trial to sort of go back and request that data to be shared. Can you talk about what are the challenges in providing data from an older study where, first of all, the investigators who ran the trial and who know that the statisticians who know the data well may have moved on to other projects or retired or something. Secondly, where there may be consent problems with what was in the consent form that people signed that either didn't mention data sharing or perhaps said data may be shared with other investigators at X university. And also what the concerns are with taking data that's on a data management system that you're now not actively using and may find it hard to kind of put onto whatever platform you're now using. And weigh that against the benefits of going back and sharing at least some clinical trials data that are older as opposed to just doing it prospectively.
Okay, you'll let me know if I don't address all of them and re-ask. With regard to the multi-sponsor site, there are differences in the commitments. GSK going back to its formation in 2000, and I have Roche back to 1999 and BI back to 1998. And I think that Sanofi's offering prospective clinical trials, and BI is currently working on their policy. So for GSK, we have a commitment to going back quite a ways, and it will be difficult for regional and local studies. And originally, our commitment was back to 2007 for central R&D because of the issues you're describing, we, moving forward from January 1st, 2013, are archiving in a consistent and uniform way, which will make it much easier. We'll have those prepped and ready, de-identified and anonymized, ready to be accessed from 2013. But moving back, we'll prepare them as requests come in because of the extreme resource utilization. And we'll do the best that we can to make those trials available according to that commitment. As far as the informed consent issue, we have back to, originally we had stated back to 2007 for the issue of uniformity of informed consents from that point until 2013. And so the requests coming in for data during that time period need to be aligned with the original medicine or disease because of the informed consent language. Moving forward from January 1st, 2013, our consents were changed to be more expansive and include the same medicine or other medicines, the same disease or other diseases in the language of the informed consent. And at this time, because of a lack of clear policy guidance, we need to follow the informed consent ethically, if not legally. The legal bar being lower, But while we have an ethical responsibility to follow the spirit of the informed consent, we will continue to do that. Legally, once the data is de-identified, and if there's a policy decision that there's a balancing of public good, that may come. But at this point, we can't do that for our ethical considerations.
Could I just follow up? So we've heard this figure of 15, it costs roughly 15% of the total direct costs to sort of provide the data sharing. Of that amount, how would you split it? I guess it depends on how many numbers come in, but you said the costs are enormous of going back and sharing older trials. Can you give us some sense of how much more expensive, how much more does it cost to go back and share older data as opposed to prospective data, just as a multiple, twice as much, 5 times?
I don't have that number, but I can tell you that it depends how many requests come in for the older data, and if it's for the more centralized R&D data. So a lot of our costs have been on developing the system, and as we move forward, it will significantly lessen, and we look forward to that.